Welcome to Season 3 of the Knack for Business podcast. Over 250 episodes strong, we're here to ignite your entrepreneurial spirit with fresh insights, networking gems, and creative strategies that elevate your game. Are you ready to discover what your Knack for Business truly is? Your hosts are Bernie Fransgroth from Creative Insight and Wayne Pratt from Motivate You Inc. So, what can you expect from the Knack for Business podcast? The aim is to help you find your feet in the business world. Whether you're just starting out or you've been at it for a while, we have something for everyone.
Today's topic is Empowering Patient Stories, Revolutionizing Healthcare Through Real Voices. Our guest today is Debra Workman, the founder of InfoCraft, a marketing communications company that provides strategic and tactical marketing solutions tailored to the unique needs of small to large businesses. With a focus on delivering uncompromised quality, InfoCraft offers a range of services from websites and collateral to channel management and marketing strategy. Debra and her team are dedicated to ensuring seamless execution, helping businesses overcome challenges and achieve their goals with creativity and enthusiasm. Whether serving startups or established enterprises, InfoCraft is committed to delivering results from conception to completion. Patient's Mirror is a joint venture between InfoCraft and Twisted Frame. Debra, welcome. Do you have a favorite quote or saying, ma'am?
Do I have a favorite quote and saying? It's one by Marcus Aurelius. You're the only one that controls your thought. If you can control your thoughts, you can control the world. That's what it means.
Patient's Mirror. What was the trigger? What was the genesis point?
InfoCraft has been primarily focused in the healthcare space. Our consultants and our employees and myself are PAB trained, which is trained in how to provide education materials and collateral materials for pharmaceutical companies because they can and cannot say things in Canada. They are not allowed to market directly to the public, and they are not allowed to market to healthcare professionals. They are, however, allowed to educate them. So it's all the rules and regulations, and there's training that goes around that. So we're very trained in that, trained in HIPAA compliance because we have built HIPAA compliant apps. And we've built them for pharma clinics, and we've built them for patient groups. And they all have different constraints based on who they are and who they are sharing these applications with. Going through this whole history of understanding what is happening in the healthcare space, along with the journey I went with both my parents and my sister through their healthcare journey, their struggles, their frustrations, their duplications of things that happened and disjointed things, and understanding more about how the hospital operates and how it's still running on very old systems. And so there's a lot of interoperability. There's no connection between the MRI machine and the backbone of the hospital, depending on which hospital you're in and which system you're on. So there's a lot of different things that are happening in our healthcare space, and people struggle going through this. And if you are an average person, we're born a patient and usually we die a patient. And in between, we would be a patient on and off, going to the dentist to get your wisdom teeth removed. But there are people out there who spend more time being a patient than they do in getting the life's rewards, which we so are lucky to have. And with conversations with these people, knowing what we know, working with a gentleman who helped me do a lot of the documentaries that we worked on for InfoCraft, we decided that we really wanted the patient's stories to be heard because there's so many problems with our healthcare, but a lot of the solutions are in what the patient says. They go through, they know what's falling apart, where they're falling through. It's to give a much better understanding of what's happening with the healthcare space. It's to give a much better understanding of a specific medical condition or a specific disease. And it's to give a better understanding how we can support these people and why it's so important to support them. So this is why we are doing it. I'm very passionate about it, especially losing 3 family members. I am so passionate about being able to help people find their voice and talk about what's happening with them. I've got some examples, but maybe I'll let you ask me some more questions.
You're right. A lot of the stories are apocryphal. They have a theme and can end up, if you're listening, but putting the stories in a form that they're available and maybe even documentable is a new thing. Tell me about how you're hoping these stories will transform the healthcare experience.
Pharmaceutical companies, medical device companies, doctors who are doing research really want real world data, real experience. And they can do a study and they do 10 people and then they will tell you this is what my experience is. But if you have a lot of people telling stories, you can find the commonality and say, okay, these are the things we need to fix. Or they can say, this is real-time information being provided to us by real patients and it's their real voice. It's not a voice they're being suggested, they say. It's their real voice. And on this journey, these people have this journey, they have heroes and enemies. They have champions out there that love and want to help patients. You go to any hospital, there's always volunteers. There's some wonderful people, and we call those the heroes. Some doctors are the best heroes. They'll give you extra information or let you do extra things. And then there are the ones that aren't. So our goal is to give the patients better control of their journey. It's important. It's so important. I can tell you my personal story going through with my sister and what happened to her. I had shoulder surgery, and I could tell you about my journey going through the surgery, the recovery, and the post-surgery program, the post-surgery follow-up, all that happened to me after the surgery. And sometimes it's a lot of things, and sometimes it's zero. These stories need to be told. Sometimes it's not necessarily the healthcare system, it's where you end up. I'm very passionate about people empowering themselves and their health. A lot of people don't know how to navigate the healthcare system. I've been very lucky because of my background, and I know how to be the squeaky wheel, to go after what I need. I'm just saying, like the 90-year-old or the 87-year-old who's the first time they've been sick in their life, or maybe they've been sick lots, but they're just so lost in the system. They don't even know how to use a cell phone, let alone ask the doctor to text me something. And so they are lost in the system. And so it's so important to hear their story, because from that story, people can become innovation and use things to help them. It's like using an app where you have to type stuff in as opposed to using an app that you can actually talk to. And then there's the AI that goes along with talking, and then the AI helping you get the information out.
So the squeaky wheel piece, is that a tactic as a marketing communications piece, except patients not being the squeaky wheel? You're doing it on behalf of them. Is that how you're amplifying their voice?
We're trying to create a platform where people can go to understand different conditions, medical conditions. And we're trying to create a platform for where, because it's not just, we just don't want to do documentaries about patients. We also want to do documentaries about the heroes and all the people that are doctors and nurses. And I'm sure you've heard that they're burning out. And I have family that is in the healthcare space. And I know this is to be a real true burnout. They're just working themselves many hours, not necessarily under the best conditions. And it's frustrating for them because there's shortages of individuals. So they're being asked to do more, which means the patient's getting less attention.
Deborah, one thing I find interesting from doing these podcasts with Bernie is hearing that you are a professional in communications in the medical field. Your sister gave you an insight that shook you. And all of a sudden you go, I have to do something about this. And then the next thing, which I don't think is a direct connect, I have the tools to do something about this. Connect me to that story.
Because things happened that shouldn't have happened. Things happened during this journey that shouldn't have happened. And some of it may have been my sister's fault because she wasn't being an advocate for her own health. My sister, bless her soul, was a caregiver and gave everything to her family, and unfortunately put herself a little bit behind, which did things she shouldn't have done, being advised against doing. But then it was all the journey along the way. I'm going to give you one little snippet. So I tend to get a lot of sinus infections. My doctor and I decided that I needed to see an immunologist to see whether or not I had compromised immune system. My family has a background disease that causes us to have a compromised immune system. The fastest way for me to see a doctor to check my immune system was infectious disease. So I did a TED talk, and at the beginning I am describing myself sitting in a patient's room in infectious disease, waiting to see the specialist. And I'm there with people who have infectious disease, probably. And I've got a compromised immune system, probably, which doesn't make any sense. And while this particular waiting room does look like something right out of the 60s. Funding, right? I didn't care about the waiting room because at the exact same time, I was being tested for my immune system. My sister was in ICU in the general hospital 2 blocks away. That's the beginning of my journey with my sister. But it wasn't just my sister, it was also my parent. But my sister was more impactful for me because I only have one sister. She's only 4 years older than I am. I really tried to do a lot to help her to get through the system and work with my brother-in-law. You can only do so much. And I'm not here to trash any or name any places or things that happen. I just know that there's a lot of compassion needs to be put into our healthcare system. There's a lot of understanding. I don't blame the doctors. I don't blame the people working at the hospital. I don't blame even the hospital itself. I know that I blame the government in some ways because it didn't happen overnight where the population of Canada got then 60. The average Canadian right now is over the age of 60. When you're over the age of 60, things start to fall apart.
No, they don't. No, they just move around.
But yeah, so then parts need to be repaired or replaced. And so that becomes with all these people in the upper part of the population using the healthcare system, a healthcare system that probably should have been bolstered up by now. So they got this healthcare system that is equipped to handle, I'm just going to give you a number, 100 people, and they're handling 1,000 people. It's just, so that's the burden. I went to Kingston. I was having needles put in my spine. It's a long story. And I asked them about what their backbone system was at the Kingston Hospital. And the lady told me what the backbone system is. I can't recall, but I knew it was an antiquated backbone system. And when I said to her, why haven't they done something about the backbone system? Why haven't they renewed it and replaced it? She said, when we get money, we buy MRIs, we buy CT scans, we buy things because people want to know that you're using our money to buy things that will help us. If they heard that we put the money to replace the backbone system, they're not going to like it as much as if they told we use that same money to buy an MRI. And so they are putting in these new pieces of equipment, but they don't talk to each other, and the backbone system's falling apart. I'm not a politician. I don't have the answers. We want to tell the story, what's really happening out there, and then have people who are educated to come up with innovative solutions. I think I mentioned about Quebec. At least they're trying to do something. I don't agree with what they're doing, but it's out of the box idea. And I think we need out of the box ideas to help our healthcare system. And making it private is not the solution. That's not Canadian. That's not who we are. We are here to help each other, not just the ones that have the money that can afford it. It should be for all people. Anyway, that's just my personal opinion. But I just think that making it privatized, all you're doing is turning us into the other country that doesn't have great healthcare.
Would you say that the patient's mirror, you talked about events that have happened that they're not typical in your life, but they're not the rare or chronic diseases that impact people. There's people that have, it's a one-off, 1 out of a million someone has an infliction of whatever the case might be. How does it bring that to the forefront and say, listen?
So I'm going to share with you, I know of a disease that's out there that on average takes 10 years for people to be diagnosed. That's 10 years of going to specialists, ending up in hospitals and getting unnecessary colonoscopies, unnecessary exploratories. They are told that a lot of this stuff is happening in their head. It's not real. 10 years of experiencing pain for no reason at all. If you're in pain and struggling, you may turn to alternative sources to help you. And that could be drinking, that could be drugs, that could be many things. But if they told their story, and if we could share their story, so people out there would understand that there are conditions, there are people who have one-offs, there are people who have these chronic conditions that last, but only show up when they hit puberty, or only show up to certain conditions. Only certain things happen when you turn 60. All of a sudden, these things happen, right? Where they didn't happen before. When these things show up, they can talk about their journey to save other people from going down the same journey. They can also help, this information could also help the hospitals and doctors to recognize that this is happening. Oh, if this is happening, this might be this. And then also why it's happening. Why did they have to have this colonoscopy? What made this decision? Preventative or innovation? We just want to help the healthcare system. We want to help patients tell their story so Canadians can see what's happening in our healthcare, what's really happening in our healthcare system, to totally understand why it happens. I mentioned that I did a video on how drugs are approved in Canada. There are two paying systems in Canada. You're either on public drugs or you're on private drugs. And they're approved different ways. On public drugs, the government negotiates with the global pharmaceutical companies for these drugs. And the price point and what they buy, it's all done by the government, and dollars and cents factors into this. We need to be able to tell that story. It has to be told. We have to make a change. It's important. It's so important that our healthcare changes. What do you guys think? You guys are in the healthcare system.
I do understand, say, if I were to say during automobile manufacturers, when you talk about one brand from North America, another brand from Europe, another brand from Japan or Asia, you get different impressions. And of course, even within the brands, they have certain models, etc. Is it the same thing for medications then, for the pharmacy side of the fence, that this one is if you had to spend $100 on a car, that's what you're getting, $100 car. And this one over here that's $90,000. And by the way, the seat heat is wonderful, and the air conditioning just blows your hair in a wafting moment. So are the medications?
The medications are different, and they have different price points and manufacturers. I'm not going to say that there is one pharmaceutical company that's better than another pharmaceutical, because I'm not in a position to say. I do know that some medications cost more than others. Either you don't have to take it as often, the way you take it is different, how it's made is different, and it affects the price point. We are not the negotiators, and we are the negotiators. We are the government, but we negotiate the price on what we're willing to pay. There's many factors. I wouldn't want to have to pick and choose which drugs we would accept and which ones we don't.
So my follow-up question to that, and I get what you're saying, and you can't say this brand is dog's breakfast and this one's the gold.
I don't think there's any drug out there that's a dog breakfast, but some drugs are newer than others. Some are more innovative than others.
But the second part of the question is, if you're not familiar with something, let's say, we'll go back to the automobile analogy. If you go out into the market, you're going, that's nice. That car has 3 cylinders and it comes with electric batteries. That car is an 8-cylinder and it goes stinks down the highway. If you've never bought a car before, what do I pick? What fits my budget? What fits my needs? The budget might dictate what your needs are going to be at the end of the day. But let's say you have an abundance of cash flow. Now, what should I pick? Do I buy a semi-tractor trailer just to go pick up groceries? That's 10 miles or 10 kilometers down the pipe. No.
Yeah.
Unless, of course, you're buying a lot of groceries and you're feeding some livestock in the process. How do you sort that out from consumer patient needs? Yeah.
So if I was a patient and I knew what was my condition, every time you're told, oh my God, we're going to have to give you a root canal and do a implant, you're going to go and find out, okay, so he says he's going to give a root canal. Who's doing it? Where it's getting done? There's the part of being an advocate for your own health. What's the price point? What's the difference between? You're going to do the same thing. If you're an advocate for your own health and you're proactive, you're going to go out there and find what is available for you. Some stuff's not available in Canada. Find that out too. Because there are things that you could do if you find there's a drug that's not in Canada or is not on label, then can I get the product off label? I'm going to use it for this, even though it's not approved for this in Canada. Is that doable? It is. There are drugs that's not available. When I did my whole shoulder research, there was the option of having injections. I did have some injections. You can have plasma put in your shoulder, but you can also have stem cells put in your shoulder. You just decide, is it worth it? Does it work putting stem cells in? Is it worth it? Where do I go to get it done if I'm willing to pay for it? It depends on the person and the condition. It depends how bad things are. I'm not a doctor. I have no medical training other than psychology, which doesn't give me any. I understand the system. I understand how things are done, and I know what I would do. And I think people need to hear the stories of what people went through and how they found out what they found out, just like I'm telling you. And they need to tell their story, because with our healthcare is we're all numbers. You go to the doctors, your patient number, whatever your health card number is, that's your patient. You're not Deborah. They don't know that I want to be an actress, and so you better not do anything to my face or whatever my aspirations are. Even people with chronic conditions, all these people have aspiration. They have dreams. They have things they want to do. They just want to be healthy, to be stable, to be in control of their lives. And I think telling their story about who they are, why they want to do what they want to do, how they're going to get there, and then tell their story about their health journey and how we can help them.
Deborah, one thing that I find interesting based on where I live is the hospital and the situation you're talking about is known to me.
Are you in Kingston?
I'm near Kingston.
Okay.
But
It's a lovely
thing-
hospital. Beautiful.
one thing that is amazing that you already noticed is depending on what room you're in, it's either 100 years old and falling down or brand new.
There are a lot of lovely people out there who have money. And those lovely people who have money will donate money for a ICU unit because they had the loved one, or just because they will donate money for specific things. So you can see, these paintings have been donated. I don't know if you've ever been in a hospice, but a lot of hospices you'll go in and a lot of donations have been made. And there's plaques all over the place saying who's donated what. And that's why in the hospital, because the hospitals the province gets so much money, then it's distributed out, and it's just, you only can get out of it what you put into it. We pay so much taxes, I don't think any of us want to pay more taxes, so we can't expect a lot to happen unless we find innovative ways of doing it.
One thing that I don't know if it's corollary or actually core to the matter, but it seems from doing podcasts and meeting people that the medical health care needs to get you to a fix quickly. And if they're overwhelmed, it sometimes seems more like being in a butcher shop than a caring institution. Yet the people selling you goo who listen to your story give you the comfort you need, even though the ingredients are almost witchcraft. It sounds like you're trying to combine these two stories into a thread that gets better health care.
It's better care for patients, whatever that care happens to be. Part of our goal is also to amplify what's happening to seniors. I don't know if you've ever been into a long-term care facility. I have been in lots of them. I used to own shares in a company that offered PSWs and companions. I was in a lot of long-term care facilities, and they're not all equal. There are not enough people on the floor to take care of the people that are on that floor because of how sick they are. But again, it's all comes down to funding. And like I said, I don't have any solutions, but I think if we can talk about the problem enough, we'll come up with a solution. Canadians are very smart. I'm going to sell these people scheduling software. You need to know what the problem is before you can find a solution. And I think patients being able to tell their story will help us find our humanity, our empathy, and come up with some brilliant solutions.
You were mentioning earlier about stuff that you can get in Canada. It's already on label, I believe.
Off label.
Off
Yes.
label. That it tips into another question, and I've seen this show up, both coming here to Canada sometimes, but sometimes from Canada elsewhere. And it's called medical tourism.
Big medical tourism is really big.
So if you needed to get dental surgery and you can't afford it, you might try a country way south of our border.
I know people have had work done. Yep.
And the driver is the financial, and it's cheaper to go south. Or
Depends where you're going overseas.
Not all locations are equal.
And not all physicians are equal, and not all treatments equal. So that would be a lot more navigating And a lot more. Maybe that is part of our innovation and our solution. Maybe we as Canadians will say part of our healthcare is we're going to send you someplace else to have this stuff. It's not our sweet spot. We're going to send you someplace else. We know the doctors, we control what's happening there. I'm just throwing an idea out. I'm not saying this is going to happen. It's just me talking. But if you want to look at healthcare as the big picture, I own a marketing company. Not all my people who work for me are employees. Some of them are contractors, consultants. Not all of them are in Canada. Some of them are all over the place. I've got a writer in England. And so maybe we could look at our healthcare that way, not bringing people in, but taking sections of it and saying, well, you can wait 6 months and have this procedure done, or you can get it done next month. But the difference is next month, it'll be over here. How are they going to work that with insurance and who's going to negotiate? Maybe the same people that negotiate the drug prices can negotiate using operating rooms in Turkey. I'm just throwing ideas out there. This is just me thinking outside the box, which we need to do. But I think we need to hear more of the stories to be able to come up with solutions, just like the opioid problem. There's got to be a solution. I'm a big believer. I say that to my daughter all the time. For every problem, there's a solution. You just got to really think about the problem or really think about the solution. If there was no solution for every problem, then we wouldn't have gone to the moon. There's always a solution for every problem.
Yeah, but one thing that I'm interested by is very nuts and bolts. I love what you're doing. It's incredibly courageous. I want to just walk through something and you can tell me how close I am.
Sure.
Let's assume I go to my medical doctor with this hard to explain ache. She, ironically, because now there's more she's than he's, then picks a journal or goes to a textbook. Are you suggesting that one of the resources, instead of Harrison's medicine, be an itemized video series and they put in the symptom and up comes the video? Is that sort of how that unpicks?
Are we talking about the platform?
Yeah.
Our platform is not going to provide medical advice. It's to tell patients stories. The medical doctors watching might come up with a solution button. We're starting with what's happening in patients' lives. These are the heroes in the patient's lives. Maybe we need more of these in Canada. Or the first thing of a documentary is to tell the story. It's like the opioid. The first thing for us to know there was an opioid problem was to hear the stories and why these people end up on the street and what we can do to stop them from ending up on the street. Being an advocate for your own health, but also one of the biggest things for a problem is to prevent before it happens. If this crisis is happening in schools because the schools are too big and so there's too many drugs and students are getting lost, then maybe make smaller schools. I'm just throwing ideas out. I'm not saying we're doing anything like that to the education system. But for us, it is to tell a story, to tell some compassionate and real stories told by patients.
So, Debra, who is the audience for these stories?
And so the audience for these stories, because they can act as education. The biggest audience is Canadians, because at some point you're going to end up being a patient. I research everything. That's who I am. So if I was doing research, the platform's going to come up. I'm going to see these videos on whatever I think I have or the symptoms of what I think I have. That doesn't mean it's going to tell me what I have. It's just going to tell me somebody else has got these things and I've got similar symptoms. Then it's up to me to find a doctor. Who's the target audience? I'm sure you know that Google's getting into healthcare and has their own health channel. That Azure is getting into, they're going to have their own health channel. TELUS has got their own health channel. These videos are going to be licensed to these health channels. Ideally, we'll be able to actually pay patients for telling their story. Because who needs money more than someone who's struggling with a chronic condition?
Well, it's paying for parking. Having been inside a healthcare institution and seeing the different driving forces, I remember a CEO one time, it was at a staff meeting. He says, we can't do this because they say we can't do it. And he said, who is they? They looked over at the CFO. I felt sorry for the CFO. It's what drives him saying yay or nay is there funding to cover it, because if there isn't any money,
there's always
a supervisor that comes into the facility and straightens everything out again.
There's always, if you talk to a CEO of a hospital, you would understand from his perspective why they do what they do. And I just explained why they buy MRIs instead of putting a backbone in, because they're trying to give the fastest solution for people who need the fastest solution. You'd be really upset if you go to the hospital and they don't have an MRI. Why don't you have an MRI machine? Yeah, I have to go to Ottawa to get my MRI done. Why? because we spent the money on the backbone system. No, that doesn't help me. They've got a lot of pulls and pushes and only have so many dollars. We could always run it all the way up to the health minister and say, why are you only giving them so much money? He only has so much money. The Canadian government only has so much money. We are a small country with big needs.
It's funding, timing, and
I understand, but I think what makes Canadians different, because Canadians are very innovative. We are like we got the most number of small business because we're innovators. We see a problem, we look for a solution. It's in our DNA. And I think that sharing stories will make people be innovative. And I think innovation should be encouraged. I think what you guys are doing amazing because you're working with small businesses, and small businesses are the innovators and the backbone of this country.
I'm just going to blue sky because it's wild. Law and Order changed how Americans viewed the court system. Are we literally going to tune in to CBC and see these stories are brought to you by, and that we're actually watching for entertainment?
Could be.
It's actually fascinating.
Our dream, our passion, our goal is to tell patients stories. Is that something that might happen in the future? If there's a need, we may. If it's going to help drive change, we may. But right now, our goal is to tell patients stories, to give them a voice. As much as they all say they're patient-centric, they are not. It's not because they don't want to be. I'm sure they do. But it's because there's a lot that goes into, you can't give all people all things all the time. There's that whole formula, right? You can't give everybody everything all the time. You can give some people everything all the time. You can give all the people some things once in a while. It's just the mathematics. It's the way it is. You guys got any questions for me? I'm so excited about this. My partner and I, he's so excited about this, and he's done a lot of documentaries, and we both have done a lot of health documentaries, but we're excited about the real stories. Not that the rest aren't real stories, don't get me wrong, but these are.
This is the patient population, it's patient stories. What do you want the patients to know?
What do we want the patients to know? They have an opportunity to tell their story, and they will be able to also hear other people tell their story so they know they're not alone. One of the biggest things with patients, and if you talk to any patient association or group, they will tell you a lot of the patients feel like they're isolated and they're all alone on this journey. There's no one there to help them.
You also want the other flip side of the coin, that either health administrators or the hospital association or government entities also to tap into.
We absolutely, we want to be able to help make policies. With this coming out, it will make people understand policies will change, divert funding, and make more stuff accessible.
If this twigs with a listener and they want to learn more,
email, phone. We are actually encouraging. We are looking for more patients for their documentaries. We're looking for stories. Of course, we're looking for sponsors. And who would want to sponsor us? A patient group, a patient foundation, pharmaceutical companies, patients associations, philanthropists. Why wouldn't they?
The patients you seek are all Canadian or just the province of Ontario?
Our goal is to do documentaries. Our larger goal is to do it globally.
I want to say thank you to Debra Workman, my co-host Wayne Pratt, and you, the Knack for Business listeners. If you're a patient, odds are you are, because at one point in time you have been. Either end of the spectrum, either showing up on God's green earth or leaving it, you're going to be a patient. In which case it'll be your family if it's the tail end of the story. Get a hold of Debra. There might be a story to relate, and you can have an impact on your healthcare in your region.
To reach the podcast hosts, email them at info@creativeinsight.com or by the website creativeinsight.com, spelled KREATIVINSIGHT.com. To reach Wayne at his email, Wayne@motivate.uca. That is MOTIVE, the numeral 8 and the letter U.ca, or his website Motivate.uca. If you would like to be a guest on this podcast and share your knowledge, let us know. We would also appreciate your feedback on the content or format. Check the show notes for more details. For these podcasts, we like to acknowledge the support and thanks to the following people: Carl Richards from Podcast Solutions Made Simple, a renowned podcast expert; Fred Crouch, who is the Property Wizard podcaster, where Bernie is a co-host; Javan Strika from At Hive, a co-working space that is more than just a space; then Melanie Weber, Bernie's invaluable business partner; and Wayne Pratt from Motive 8U Inc., who serves as both a coach and co-host of these podcasts. Disclaimer: please note that the Knack for Business podcast episodes are meant solely for educational and general informational purposes. The information and opinions contained within are not intended to be professional advice on any subject matter. The thoughts, views, and opinions expressed by the participants are their own personal beliefs and do not represent the views of the podcast hosts or any affiliated organizations. It is important to note that this podcast is not a replacement for consulting with certified experts in your area who possess knowledge of your unique situation. The hosts of the podcast, along with any participants or affiliated groups, do not take responsibility for any actions taken or not taken based on the information presented in this episode. It is highly recommended that individuals seek guidance from their own personal advisors in fields such as accounting, law, or other pertinent areas prior to undertaking any actions or making decisions that may impact their financial, legal, or other aspects of life.